Hello everyone, we are from Group 4. Today we are going to present to you about Klinik Optometri Bergerak. These are our team members. We have Hafizuddin Hakimi, Nurul Atira, Nur Ali Sabrina, Nur Juhaida and Zukrin Shahira. Klinik Optometri Bergerak is an impactful initiative where optometry students from Universiti Kebangsaan Malaysia travel to various locations throughout Malaysia to conduct an eye screenings for the public. The main goal of KOB is to extend essential eye care services to communities that may not have easy access to vision care, such as senior citizens, children, villagers, and others in need. By joining this program, UKM students not only gain valuable hands-on experience in their field, but also contribute meaningfully to society by detecting vision problems early and educating the public on eye health. For this time around, KOB has been invited to a variety of venues, including KKM Dataran Auditorium Putrajaya, SJKT Rantau in Negeri Sembilan, SK Prison 11 to Putrajaya, and SMAP Labu Negeri Sembilan. Through these outreach efforts, Klinik Optometri Bergerak nurture the sense of social responsibility in the future optometrists while improving access to quality vision care and raising awareness about eye health issues among diverse Malaysian communities.
Let me share about our involvement in Klinik Optometri Bergerak 1, which took place on April 13, 2025 at KKM Dataran Kehakiman Auditorium Putrajaya. This community outreach program was primarily organised by the Ministry of Health Malaysia, also known as Kementerian Kesihatan Malaysia KKM. The main goal was to provide free health screenings, including eye care to the public, with the participation of optometry UKM third-year students. We were involved in conducting various eye examinations and vision screenings while offering basic eye health advice to the attendees. This meaningful experience not only helped raise public awareness but also gave us a platform to apply our clinical skills in a real-world setting. In total, we managed to screen 93 participants, consisting of 66 females and 31 males. From this program, about 87 individuals did not require new prescriptions. 6 individuals were referred to optometrists for further investigation and specialized care. However, there were no free spectacles were distributed during these events as the focus was primarily on screening only. It was such a good experience to be part of the history-taking team. At first, I was kinda clueless on what really need to be asked, what to investigate, and where I should expand the questions to make it more relevant so that the eye checkup can be done quickly based on the patient's needs. Somehow, I gained my confidence to communicate with the patients and I became curious to know more about their complaints. I learned how history taking is really important as it is the first part where we discover every inch of the patient's complaints and eye history. Without good history taking, some things might remain uncovered and the management for the patient itself might not be fulfilled enough.
On consultation, I realized that some patients just wanted to know briefly about their eye condition. I do take time on explaining things to the patient when their results in some tests are shown as something out of normal range. At the end of the session, they just wanted to know whether their eyes and vision is considered as normal or not. If I join consultation team in future KOB, I would emphasize on explaining to the patient about abnormal clinical findings to avoid too long waiting lists for consultation purposes.
Now for my part of reflections. When I have to consult with the patients, I often feel unsure how to start the conversation or structure the consultation. I also struggle with deciding on the appropriate management plan, and I need to improve my confidence and develop a clearer systemic approach to patient consultations.
For this KOB, I was assigned to do an entrance test. I learned how important it is to do the test quickly and accurately in a busy situation. Even though there is many patients queuing, waiting for their turn, I learned to stay calm and focus on the current patient. so that I do not miss any step while doing the test and can manage the patient as best as possible. And also the importance of giving an instruction to the patient and explain about the test in layman's term so that the patient understands clearly what's going on. Also how to communicate properly with patient, especially if we suspect there is something wrong with them, so that they will not feel uncomfortable with us.
During the first KOB session, I had the opportunity to perform VA assessment and cover tests. I learned the correct techniques and how to give clear, simple instructions, especially when working with children. I realized that calm and structured communication is essential to ensure their cooperation throughout the examination. With the lecturer's guidance, I was also able to improve my cover test technique. Overall, this experience was valuable in enhancing my practical skills and boosting my confidence in patient interaction. Now, let me share about involvement in Clinic Optometry Bergerak 2, which took place on May 17, 2025 at SKKT Rantau Negeri Sembilan. This program, held in collaboration with Maxview Vision Syndrome Berhad, provided free eye screenings to 150 participants, 91 females and 59 males, mainly from the Indian community in Rantau Negeri Sembilan. The initiative aimed to raise awareness about eye health while enhancing UKM optometry students' clinical skills, communication, empathy, and professionalism. It also promoted social responsibility by offering students a valuable opportunity to engage with the community and serve undeserved populations. Out of all the participants we screened, 123 was prescribed glasses, while 14 did not require any prescription. Additionally, 8 participants were prescribed a new prescription and referred to a hospital or klinik kesihatan at the same time, while 5 participants were directly referred to a hospital or klinik kesihatan for further investigation of their eye health.
From this KOB, I think I am more exposed to elderly patients and I learned on how to communicate properly with them. During that day, I was in charge of entrance test and from the experience, I acknowledged a lot of things that I need to improve, which is basically my skills and how I record the results for each test. Other than that, I love this KOB so much since I also get to interact with my classmates better. Overall experience, I enjoy this KOB so much and I'm looking forward for the next KOB.
For this time around, being in charge of the VA station drained my energy so much. Standing there for hours feel like eternity. But to be honest, I do learn a new chart and improve my cognitive skill on how and what to do to illiterate patients to evaluate their VA. Dealing with many patients that they also improve my communication skills with patients that couldn't understand bahasa or English.
During my second KOB, I was in charge of the history-taking station, and throughout this, I learned how to communicate with patients using layman terms, which helped me make the conversation easier for them to understand. I also improved my skills in asking more relevant and structured questions during history-taking to gather better clinical information. In addition, I was also responsible for the refraction station, and since most of the patients were the Indian community, I learned how to give clear and simple instructions, especially during subjective refraction, to ensure they could follow easily and respond correctly.
For this KOB, I have been in charge for the consultation. I learned to brainstorm all the patient complaints and relate with clinical finding and provide the best solution and give advice to the patient. It is a great experience because at the same time I feel like my communication level have improved a lot.
For me, this KOB was very a valuable learning experience, especially in improving my skills with the slit lamp. I gained hands-on in practice examining the entire segment and identifying common eye conditions. It also helped me develop better communication skills, particularly when explaining procedures to elderly participants. Overall, the experience boosted my clinical confidence and highlighted the importance of early detection and accessible eye care in the community. For this third KOB, it was held at SK Presintu Putrajaya on 14 June 2025. The purpose is to provide free comprehensive eye checkup to a student from SK Presintu Putrajaya with the participation of optometry UKM third year student. The number of participants screened was 85 participants. There are 6 participants who were prescribed with a new prescription and were referred to a hospital or clinic kesihatan at the same time. There are 10 participants who were referred directly to a hospital or clinic kesihatan. And there are 15 participants who were prescribed with a new prescription.
I was entrusted to handle the auto-reflection station. This experience gave me the opportunity to improve my clinical skills, particularly in managing young patients who were unfamiliar with eye examinations. One of the challenges I faced was ensuring that the children remain focused and cooperative during the procedure, as some of them were easily distracted or nervous. I learned the importance of using a gentle tone, clear instructions, and a patient approach to make the children feel comfortable and at ease. Overall, I enjoyed this KOB so much, just like how I enjoyed the other KOB before.
I was a runner for whole station on that day. If you ask me how was it, phew, it's more tiring than what you see. The task might look simple, but going back and forth, replying to the parents' questions about their child and thinking how to handle impatient parents at the same time on the day to keep everything under control was really challenging. However, I would say it was a fun experience talking to the kids again.
I was assigned to the VA station. It was challenging at times, especially when handling special needs children who had difficulty focusing or understanding instructions. However, the experience taught me patience, adaptability, and the importance of empathy in providing care. It was a meaningful opportunity to learn and contribute to the community.
I was in charge for the history taking part. This KOB involving kindergarten and primary school kids, so I need to give like a real life situation instead of asking complex question so that they can understand what I'm asking. As example, my question is like, in class, where do you sit? Like in front or at the back of the class? While sitting, can you see what the teacher is writing at the whiteboard clearly? Like that. So the patient is easily understand what I'm trying to ask.
During this KOB, I was in charge of the entrance test, specifically performing AA for the school children. It was my first time conducting entrance tests during KOB, and at first I struggled a bit when instructing my first patient, as the child was quite young and not very cooperative. However, I managed to handle the situation, and after attending to a few more patients, I became more confident and was able to give clearer instructions. Most of the young patients were then able to understand and follow my instructions well.
Last but not least, Klinik Optometri Bergerak 4, Kembara Sihat 4.0. Klinik Optometri Bergerak 4, Kembara Sihat 4.0 is being held on 25 Jun 2025 at Sekolah Menengah Agama Persekutuan Labu Negeri Sembilan. The objective of this program was mainly organised in collaboration with Pusat Kajian Kesihatan Community Reach UKM with a sponsor of Hanizah Optometry, Hoya and Mandarin Optomedic. This program aimed to provide free health screening to the secondary school student and provide free glasses to those who need it with the participation of UKM optometry third year students. The number of participants screened is around 277 participants and 137 is male and 140 is females, with a majority 13 and 14 years old. Compared to all our KOB, this is the most participant that we ever screened. The number of participants prescribed with glasses is around 50 participants, around 18.1% were prescribed with new prescription. And also a total of 4 participants, around 1.4% were referred to a hospital or clinic for further investigation.
Participating in the KOB with secondary school students was a meaningful experience. During the program, I was mainly assigned to the history taking station, which enhanced my communication skills, especially in adapting my questioning techniques to suit the age group. I learned to ask clear, simple questions to ensure the students felt comfortable and were able to provide accurate response. In addition to history taking, I also had the chance to perform reflection in the mobile clinic bus. although it was a short session, working in a tight space was a new and valuable challenge. Overall, I am thankful for the opportunity and I am looking forward to more community programs like this.
I was in charge of performing reflection for students. This experience helped me strengthen my clinical skills and exposed me to various cases, including undiagnosed amblyopia in teenagers, which taught me how to manage and communicate such findings effectively. I also learned how to adapt my approach depending on each student's needs and level of understanding. Overall, it was a valuable experience that deepened my confidence and highlighted the importance of early vision care in the community.
During the last KOB, I was in charge of VA and cover tests. Among all the KOB sessions I've joined, I found this one to be the most meaningful. I noticed an improvement in how I give instructions to patients, and I was able to perform both VA and cover tests with greater confidence and accuracy. I also really appreciated the overall environment. It was supportive and encouraging, which helped me stay calm and focused throughout the session.
For this KOB, I was assigned to become a leader. I need to make sure everything runs smoothly. It was a great experience since this is the biggest participation we've managed compared to all our KOB before, which involving almost 300 students. I think the program went quite smoothly considering we are short-handed. Thank you everyone for the cooperation given to manage this last KOB for the semester.